morning.
Good morning. Thanks so much for having me.
Thanks for your talk. So I see that you're deep in wellness land over there, out in nature and getting some morning sunshine.
Correct.
Yeah, good. Thank you so much for your talk. I was both posing and attempting to answer just from a physician perspective some of the lifestyle changes that you had mentioned in your informative talk. One of the questions we had was regarding prioritization of some of these changes. If you had any recommendations about which ones that would benefit most for patients who are hoping to reduce or eliminate medication use for some of these chronic conditions that you talked about, such as hypertension and diabetes. Do you have a priority for plan of attack?
Yeah, I think that's a great question. And it is something I think to keep in mind and discuss with your physician as well in terms of priorities, particularly if you have multiple, health issues you're trying to face at the same time. That said, if there were one of the things I could think of that seems to be most associated with reduction in medication use, I tend to find, really maintaining a healthy weight can be a fantastic preventative strategy for multiple chronic diseases, right? Whether that's high blood pressure, whether that's diabetes. We see that a lot of different factors improve when you can maintain a healthy weight. And in some cases, that's not losing very much weight, like for blood pressure in particular, right? Even losing as little as 10% of your body weight, which may not be a weight you have in mind of, wearing a certain outfit from high school or looking a certain way, but a little small shifts in your body weight can really make a big impact in your health outcomes, which may, obligate the need for medications to treat them.
True. Excellent. What about the collaboration with patients and their physician and their pharmacist, if they're lucky enough to have one like you as a background in wellness and coaching? How would they go about on a timetable collaborating with their physician so that there can be encouragement with this goal of hoping to reduce medication use? What if there's resistance from the physician side of things in terms of wanting to reduce dosing? Do you have a time frame that you give patients or any tips from the coaching aspect of things as to how they would go about that interacting with their physician?
Yeah, I think that's an interesting question. And I will say that I think timeline is highly individualized and really variable based on, each person's current state. Where are they at and where are they trying to get? But probably just really having open conversations with your physician about what your goals are and asking them as well, how urgent is it that I address this issue in X amount of time? Maybe making a commitment with your physician that, I'd like to try it this way for 3 months or 6 months before I make, that switch to medication use. So I think just really having a partnership with your physician to understand, your specific risks, and setting some goals, and asking, for those opportunities to incorporate the wellness aspects, because it will take time to adopt any new habit, right? There's a lot of research on healthy habits that says, you really need 3 weeks at minimum to start to feel comfortable with a new habit. And more likely, the more time you practice with that habit, whether that's a diet change or an exercise change, the longer it is likely to stick and become second nature. So I think just having those open conversations and really being clear about what your goals are, but also remembering that it's not a failure or a shame if you do need some medication, right? There are some conditions where medications would be the best option. And particularly if your risk is high, for a very negative outcome, you may want to start medication right away as you try to attempt these wellness goals and then look towards being able to remove them at a later time, if that's what's best.
So you gave some excellent resources on habits. And here's a question. Why do we so easily default, do you think, to the bad habits and find it so difficult to acquire the good ones?
Ooh, that's an interesting question. I would suspect, if we're going to use terms bad and good, which some like coaches or dietitians would not want you to use to categorize anything as bad or good. But I would say some of the more challenging habits, right, that seem to have negative health consequences, smoking, maybe enjoying high fatty, high salt, or high sugar foods that could contribute to different health problems, including weight gain. Unfortunately, it's somewhat of our biology, right? Like our body as animals, as mammals, we've developed to seek out certain elements in food because they may be scarce at times when we didn't have the conveniences of supermarkets and refrigerators and kitchens, and food was less plentiful. So finding something that may have been of higher fat content or higher sugar content, or maybe with some salt, which may be a needed mineral, was an advantage. And so we're somewhat hardwired to enjoy those things and to seek those things. And so they may be a bit easier to crave. And then for things like smoking, nicotine is obviously addictive. Alcohol use, we know that, alcohol can have certain pleasurable characteristics, which could also use people to want to partake more than maybe is a healthy limit. So I think it's just really a challenge. We're fighting against some things that are, pleasurable to some degree, but when overdone can have negative health consequences. So I think, looking to find the pleasurable aspects of exercise, or looking to find the pleasurable aspects of trying newer or healthy foods, or substituting maybe healthier options, can really help you to increase those chances of having those healthier habits like stick a little bit. So maybe if you're reluctant to be more active, but you really enjoy socializing, finding a buddy who can go with you, who can be a partner for a walk or taking a fitness class, then the reward of having that socialization maybe offset some of the challenge for you if you aren't really intrinsically motivated to be active.
Yeah, sounds like finding supportive tribes and a community that also reinforces some social support around these positive habits is also a really important aspect to think about.
Yeah, for sure.
Yeah. What are your thoughts on patients that are looking toward optimizing health and wellness before disease states, and they're looking into some recommendations from you around the world of supplements? Big topic. Wasn't entirely what we were going into in terms of the health and wellness habits, but we always get a lot of questions around this, and I'm sure you do as a pharmacist and wellness coach as well. Could you share with us any thoughts about that from a preventive, kind of proactive standpoint? What do you recommend?
Sure. And I will say, as a pharmacist, a lot of what we learn about medication use is really founded in science and research. And one challenge with some supplements is that they are not regulated in the same way as medications. They may not have the same requirements to do a rigorous scientific studies or challenges, to sort of prove if the benefits outweighs the risks. So from that regard, I would say there's less clear evidence that would recommend any one supplement as having, a magic formula or something you should take, everyone should take. That said, an approach I've sort of used when working with people who, have an interest is to, on an individual level, assess if that supplement that you're interested in, what are your motivations for that? What are you looking to achieve? Are there going to be any known negative risks from you taking that, which may include interactions with other medications that you use? And then it does become somewhat of a personal preference, right? If that's really important to you and it's something that you really want to try, and it doesn't seem that it's going to have a negative consequence that we're aware of, or a drug interaction, sure, it might be reasonable if that's important that you want to give it a try. So I can't say that any one, supplement sticks out as like a mandatory thing. In certain instances, right, different vitamins might be recommended, but I think the best vitamins you can get is just from a really healthy, well-balanced diet. And then, most of the time when in healthcare, physicians or pharmacists are recommending supplements, it's because there's been a real identified need for one specific thing due to a health issue.
Yeah. So again, hitting the highlights around the importance of a well-balanced diet, healthy body weight, regular exercise, some of those key basic pillars that we hear about over and over again probably have the biggest impact on prevention, is what I'm hearing you say.
Yes, I would agree.
Okay. Well, thank you so much for your time. Appreciate your live Q&A and your excellent informative talk. And to our audience, we're going to take a brief break and we'll start again at the top of the hour.